Hi, Dr. Yass here. Today I wanted to talk about this idea that I've heard a lot going around about how to resolve pain at the neck or lower back. And it relates to the idea that if you notice that you're having some sort of improper posture, that if you try to address the postural deficit, that somehow this is going to take away the pain. So for instance, if you had forward head posture, or you were in a big anterior tilt or hunched in the lower back, that somehow if you address the postural deficit, that would resolve the pain. So in a sense, what people are trying to convey to people, these medical practitioners, is that the cause of the pain is improper posture. This is insane and illogical and makes no sense. The implication is that posture is an entity like a kidney, a liver, or a spleen. Posture is the culmination of the pulls of muscles. The position of a bone is based on the muscle attachments and the forces of those muscles to the bones that create the joint or the spine or any of this type of thing. So if someone has forward head posture, it's not like the spine consciously said to itself, hey, let's move forward. Let's be in a situation where we're not in the proper posture, right? It didn't accidentally happen. It happened most likely because there was weakness or imbalance of muscles, which caused the vertebrae of the neck or the vertebrae of the back to become misaligned. So on one hand, you have chiropractors saying, oh, if you have improper posture, let me just adjust your spine and I'll put it back in place. If you can't wrap your head around the idea that bones are innate, just like a kidney, liver, or spleen, and they don't have a ability to move, and the only thing that will locate a bone is a muscle, then you would have to recognize that this idea of somebody moving a bone and it staying would seem somewhat fictitious, right? Doesn't that make sense to people? So if you had forward head posture, the highest probability is that some muscles in the front of the neck are stronger and shorter than muscles in the back, which are weaker. And wouldn't it kind of make sense that the answer would be to stretch the muscles in the front of the neck and the chest and strengthen the muscles in the upper back to pull the head back so that the ear was maintained in line over the shoulder and the shoulder over the hip, which would create proper posture of the neck? And in the case of the lower back, where you have, if this should be a very comfortable, mild curve in your lower back, you have an excessive curve, and this is the front of the body and this is the back of the body, wouldn't it make sense that the muscles in the front of the body are probably stronger than the muscles in the back of the body? And therefore, they're pulling you excessively into an arch. So wouldn't it make sense to stretch the muscles in the back, front of the body, and strengthen the muscles in the back of the body so they would be able to pull this out, leading to a more normal curve? If you have hips higher one side than the other, who's going to make the hips be level? I'm not sure. Adjusting your hip joint, you think, is the answer? Does that make sense to anybody? Your pelvis is controlled in its position side to side based on two muscles on either side of it, which attach from the pelvis to the hip joint called the gluteus medius muscles. If you have some situation where one hip is higher than the other, doesn't it kind of make sense that the forces on either side are not equal? And therefore it would be a strengthening of a glute med that's weak to balance the two, which would probably lead to a level pelvis. I find it hard to believe that people are so quick to accept what a professional says just because they're professional. You have to stop this mindset that medical practitioners somehow know what's correct simply because they have a medical degree. There have been so many failures in the history of medicine that history shows that just because people say stuff, it doesn't mean it's right. The use of the MRI clearly is baseless. Clearly it uses correlative theory. Oh, I found the herniated disc while you're having pain, therefore the herniated disc is the cause of the pain. Well, the MRI would show you have 2 elbows. How come 2 elbows isn't the cause of the pain? Who told you that the herniated disc began at the time you have your pain? Isn't it more likely it existed for years, if not decades prior? So then it probably couldn't be the cause of your pain. How about the fact that as many people without pain have the same herniated discs? You're telling me the cause of the pain is the herniated disc, but as many people without pain have the herniated disc. So how could herniated disc cause pain? Oh, because to fit their narrative, you have the magical pain-creating herniated discs. And then the non-pain-creating discs, right? That certainly would make sense to people. Or does it make more sense that discs don't cause pain? They're just found magically because the MRI finds them. And yet, when you're in pain and you find the herniated disc, it's because a tissue in the area happens to be eliciting that pain, which in most cases, 98% to be exact, it's muscle. So, going to someone to fix your posture is foolhardy because you have to start to recognize that the postural deficit is actually a symptom, just like the pain, of weakness or imbalance. What makes the Yass method the only diagnostic model, not treatment model. You don't have to worry about treatment if you can't diagnose the tissue in distress. It's the only diagnostic model that attempts to interpret the body's presentation of symptoms. What are symptoms? Not just pain, altered posture, improper movement patterns, flexibility deficit, strength, palpation, actually feeling tissues to figure out what tissue is eliciting your pain. So you got the psychopaths all trying to tell you you have structural causes of your pain because of the MRI, convincing you that somehow it found something, which all it did was find the equivalent of your ear, your eye, or your nose. It's just something that exists. And it's not like cancer. The mere identification of it does not warrant some sort of treatment. They're more like wrinkles, which are structural variations, but the integrity of the structure is completely intact, just like your skin. No one goes and gets skin grafts every time they get a wrinkle. And yet, there's a recognition the skin still works, even with the wrinkle, to keep antigens out of your brain, out of your skin, out of your body, right? That's what the skin does. Well, the disc works the same. The bone works the same. It all basically works the same, even with these variations. They're just like wrinkles. They're not like cancer. So you got the mental cases all trying to convince you that. And then you have this other group of people who are saying, no, it's muscle. And they got that part right. But then the answer is, well, since they see muscle and a way that they see altered posture, they're trying to say that the altered posture is the cause of the pain, which is correlative theory again. You have pain, you have altered posture, therefore altered posture is causing the pain. It's the same premise, just in a different light. It's still correlative theory. If you can wrap your heads around the idea that posture is the culmination of pulls of muscles, which I find very hard that someone can't understand. You live in a gravitational environment. Gravity is pushing down on you. Therefore, anything you attempt to do is based on the idea of your muscles having to push against against gravity to do what? To allow for movement, but also to allow you to stand or sit or whatever else. So if you're standing or sitting or whatever else in a way that's not normal, what could possibly be causing that? Muscle weakness or imbalance. The more people who are willing to recognize you do not fix posture by fixing posture, which is to say you are consciously going to change. Oh, do chin tucks, do chin tucks, do chin tucks. I don't know what that has anything to do with anything, right? And telling you to keep your head up or stop arching your back or any of this stuff. Well, that's wonderful while you're thinking about it, but then what happens when you stop thinking about it? The pulls of your muscles will identify the position that your bones will be determined in. And again, you will have bared posture. Okay? So this has to make sense to people. Please, let's all try to wrap our heads around logic. Stop listening to people because they got a degree or wear a white coat. Logic will take you to the Holy Land. The Yass method is the only diagnostic model that interprets the body's presentation of symptoms to identify the tissue in distress. In more than 98% of cases, the cause is muscular. Indications of muscular causes are things like it takes an activity to make your symptom come on or make it worse. Altered posture is a symptom. Pressing on a muscle and igniting the pain signal are all indications that you have a muscular cause. You don't fix the postural deficit by telling people to improve their posture. You fix the muscular deficit that's creating both the pain and the postural deficit. Please, let's start to make sense of this. If you want to get more information about how to use the Yass method, or if you've said, you know what, after all this time, all the treatments, all the surgeries, all the medications, all the money I pissed away, I'm starting to think this guy sounds like he knows what he's talking about, and it is a muscular deficit creating my symptoms and my dysfunction. You could contact me directly by email at drmitch@mitchellyass.com, drmitch@mitchellyass.com, drmitch@mitchellyass.com. You can get lots of information about the Yass method. We have the YouTube channel at Dr. Mitchell Yass there. We have Facebook at the Yass method. You could go on my website, which is mitchellyass.com. You have my books, Overpower Pain, The Pain Cure RX, and the Yass method for pain-free movement. But ultimately, if you ever want to resolve your pain, and it's muscular, trust me, you're never going to get that through any medical practitioner, because with the golden goose of diagnostics being the MRI for these people, muscular causes don't show up. And none of these medical specialties are educated or trained to identify muscular causes. The Yass method sits outside the medical system. Doesn't matter if I have a doctorate in physical therapy. That's meaningless. What counts is the fact that I went beyond my medical education and I said, it doesn't make sense. I need my own method. And I began to interpret the body's presentation of symptoms to identify which tissue is creating the symptom. And whether it's structural or muscular, the symptoms will tell the tale. And it turns out in 98% of the cases it's muscle, which is great for you. Because if it's a muscular problem and you have some sort of weakness, who's going to fix that? Nobody can, make you stronger. You can get to do that. You start to become empowered and recognize that you have the power now to control your symptoms and the level of function you want to achieve. You're no longer a prisoner of the medical system. You are no longer a prisoner to a diagnosis that says they can fix that. And beyond fixing it, other than that, we can give you lots of medications and lots of wacky treatments. So, if you have the chance to find out that the cause of your pain is muscular, that is probably the best news you'll ever get in your life. Because that muscular deficit is probably weeks away from being fully resolved and pain-free. But you better come to somebody who understands how to do Yassercise, which happens to be the core of how treatment is provided in the Yass method, which is the mechanism by which isolated muscles are strengthened utilizing progressive resistance, causing the muscles to adapt to greater and greater resistances, which makes the muscles eventually become stronger to the point where they can perform your functional tasks without straining and eliciting pain. And in terms of posture, will allow you to have normal posture so that you can function optimally. So not only do you get a resolution of your symptoms, but you get to function in a way that you've so desperately desired and have been hindered from achieving because nobody's ever been able to tell you that you had a muscular deficit. So that's the story. I wanted to get this out there because I'm sick of tired of hearing people talk about the fact that they're trying to correct their posture through bizarro ways, thinking that changing the posture changes the pain. And ultimately, there must be a realization that it is the posture which is a symptom. The altered posture is a symptom, just like the pain of muscle weakness or imbalance. The only way to resolve the pain, the only way to resolve the postural deficit is through strengthening of the appropriate muscles. The only way to identify which those are and how to do that is through the Yass method. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. If you're loving these videos, please subscribe to my channel. I greatly appreciate it. It helps to get YouTube and even Google to raise me in search and allows them to try to send this information out to more and more people, which is my ultimate goal. 130 million adult Americans in the United States, roughly 1 billion people worldwide suffering from chronic pain. We can do this together. All I hear about coronavirus is we're all in this together. Well, the only way you're ever going to resolve the chronic pain epidemic globally is to all work together to change the system and the use of the MRI and the idea of the system being fee for service, which simply means that if a person does something for you in the medical system, they get paid regardless of outcome. As long as those two things are there, the idea of anyone's pain being resolved is basically nil. All right? So for now, let's work together. Let's try to end chronic pain. Let's get everybody the lives they so justly deserve. All right? Dr. Mitchell Yass saying bye-bye for now.